Welcome to this deep dive into a real classic in the world of antibiotics, Penicillin G. And we're going to, dig into the essentials from Kucers. That's Kucers, the use of antibiotics, of course. But we're going to be thinking about your perspective as a medical microbiologist. I got to say, even I was a little surprised by some of the stuff in here, especially when I saw that foreword mentioning quinine and its connection to penicillin. Kind of wild.
It is really interesting how, all these discoveries kind of intertwine with history like that.
Yeah.
And, quinine tackles malaria. But penicillin's legacy, I think it's safe to say, is really in its battle against bacterial infections, right? And that's what we're going to be breaking down today. We're going to follow that, that classic Kucers structure, the description, activity, mechanism of action, administration, pharmacokinetics, toxicity, and, of course, its clinical uses.
Sounds good to me. So let's start with the basics then. What exactly is Penicillin G?
Well, at its heart, penicillin G is derived from 6-aminopenicillinic acid, or 6-APA. And this was, a huge discovery, I think. I think it's safe to say a turning point in how we treat bacterial infections.
Yeah, it's easy to forget how revolutionary it was back then, right? I mean, now every med student knows about it. But let's get into, what makes it tick, like its antimicrobial activity. There's that table on page 217 of Kucers with all those breakpoints. Can be a little overwhelming. What should a medical microbiologist, like the person listening right now, what should they really be focusing on?
You're right, those tables can be really dense. But the main thing to understand here is penicillin G's strengths and, maybe even more importantly, its weaknesses.
Right.
It's great against streptococci. I mean, it's a powerhouse, makes it a go-to for a lot of infections caused by those bacteria. However, it struggles against staphylococci, especially those penicillinase producers.
Ah, yeah, penicillinase, that bacterial defense mechanism that breaks down penicillin. So staph infections are where we need to, be extra cautious with penicillin G.
Exactly. And it's not just staph. You'll also notice that penicillin G struggles generally against gram-negative rods.
Okay.
So knowing your gram stains and the local resistance patterns, I mean, that's really key.
Yeah, it's like a microbiology chess match.
Yeah.
Knowing your opponent's moves.
But this is where I think it gets interesting. Kucers really emphasizes how susceptibility isn't like a black and white thing.
Right.
Page 22 even mentions, for example, how pneumococci, with different levels of resistance, can still be susceptible in pneumonia, depending on the dosage and the administration.
Yeah, that's a really important point for any medical microbiologist because it really highlights how you need to understand that susceptibility data in the context of the infection site. Like the concentrations that the drug can achieve and how you're actually giving it.
Yeah. Sometimes just tweaking those factors can make a real difference in whether the treatment works or not.
So it's not just about the bug, but the whole battlefield, I guess you could say. Now, before we move on, can you just quickly explain how bacteria develop resistance to penicillin G in the first place?
Yeah, so the key there lies in those penicillin-binding proteins, often called PBPs.
Okay.
As resistance develops, the bacteria gradually alter their PBPs, like it's a step-by-step thing.
Okay.
You can imagine it like building a wall. Each change makes the wall a bit thicker, eventually blocking penicillin from actually reaching its target.
Okay, so they're constantly evolving their defenses. Now, let's look at how penicillin G actually does its thing, like its mechanism of action. It disrupts bacterial cell wall synthesis. We know that. But can you kind of break that down for us a little?
Okay. So imagine the bacterial cell wall as kind of like a carefully constructed fortress. It's essential for their survival. And penicillin G is targeting the very bricks and mortar of that fortress, a component called peptidoglycan.
Okay.
So it's like sabotaging the construction process, precisely.
Yeah.
And it does this by inhibiting a crucial enzyme called transpeptidase. This enzyme's job is to build and maintain that peptidoglycan layer. And what penicillin G does is it acts as a decoy. It mimics a building block of peptidoglycan, so it effectively jams up the machinery.
Oh, okay.
The result is a weak and unstable cell wall that can't protect the bacteria anymore.
Clever. It's like throwing a wrench in the gears.
But knowing how it works in theory is one thing. How do we actually use penicillin G to treat patients? How is it administered?
Well, that's where we move from the lab to the clinic.
Yeah.
We have two main preparations, crystalline penicillin and procaine penicillin. Crystalline penicillin, it's like a rapid response team. It gives you those really high blood levels quickly.
Perfect for those severe infections. But Procaine penicillin, on the other hand, that's more of a slow and steady release, providing those kind of sustained lower levels.
Okay. So it's about choosing the right tool for the job, basically. And speaking of tools, page 28 of Kucers has that kind of scary dosage table. How do we make sense of all those numbers, all those recommendations?
Well, that table, I guess you could think of it as your roadmap.
Okay.
But you have to consider, of course, the individual patient and their specific infection, how severe the infection is, age, kidney function, even in some cases liver function. All of these things influence the dosage.
Right.
For instance, someone with kidney problems will need a lower dose to avoid potential toxicity.
So it's like a personalized prescription tailored to each patient.
Mm-hmm.
All right. So we've administered the Penicillin G. Let's trace its journey. Pharmacokinetics. What happens now?
Well, first off, it's really important to remember that Penicillin G isn't absorbed very well orally, which is why it's usually given parenterally, either, into the muscle or into a vein.
Right.
Once it's in the bloodstream, it gets distributed throughout the body, reaches various fluids and tissues. There is one big exception, though.
Yeah, you're talking about the blood-brain barrier, right?
Right.
Kucers mentions that Penicillin G has a hard time crossing that.
Exactly. That's something really important to keep in mind, especially when you're dealing with infections in the central nervous system.
Okay.
Now, the half-life of Penicillin G, or how long it stays active, is also really crucial. And remember that table on page 28?
Mm-hmm.
It shows how things like age and kidney function impact that half-life.
Yeah, so it's like a constant balancing act, right?
Right.
Making sure the drug gets to where it needs to go and minimizing those side effects. And speaking of side effects, let's talk toxicity. What are the potential downsides of using Penicillin G?
Well, the biggest worry is hypersensitivity reactions, and unfortunately they are pretty common, and they often stem from past exposure to penicillin. Our immune system, it can sometimes overreact, leading to those allergic responses.
Yeah. Kucers actually goes into quite a bit of detail about the immunology behind it, mentioning things called haptens and antigenic determinants. It's all on page 30 if you're curious. But for a busy microbiologist, what's the key takeaway here?
I think the main point is that we have to be very aware of penicillin allergies.
Yeah.
Taking a good allergy history and even thinking about skin testing when it's appropriate.
Right.
Can really help us reduce the risk of some serious reactions.
I was surprised by a statistic on page 31. Apparently, anaphylactic reactions went down a lot after skin testing was introduced more widely in the U.S. Shows how even imperfect tools can make a difference.
Absolutely. And while hypersensitivity is a major concern, we can't forget about other potential toxicities, like neurotoxicity, hematological side effects, electrolyte disturbances. These are, they're less common, but they're still important to be aware of.
So it's about weighing those risks and benefits for each patient. Now, let's get into what I think you're probably most interested in, the practical side of things.
Yeah.
Tell us about the clinical uses of Penicillin G from a medical microbiologist's perspective.
Okay. Well, think of Penicillin G as a trusted weapon in your arsenal.
Yeah.
Especially potent against those streptococcal infections.
Right.
It's often the first choice for pharyngitis, although Kucers does point out the possibility of carrier states. It's on pages 34 and 35.
Right.
That means that even after treatment, some people can still have the bacteria.
Yeah.
And they might spread it.
Okay. What about meningococcal infections?
Right.
I remember reading about how important it is to treat those quickly and how there's a chance of resistance. It's on page 36.
Yeah. Meningococcal infections are definitely a race against time. And yes, resistance is a growing concern. That's why it's crucial to stay updated on those local resistance patterns.
Right.
And to choose other therapies when you need to.
Yeah. Syphilis is another major infection where Penicillin G is really effective, right?
Yeah, absolutely. It's still the gold standard for treating syphilis at all its different stages.
Yeah.
And, beyond those big ones, it's also effective against diphtheria, anthrax, actinomycosis, and infections caused by Clostridium species.
Wow. That's quite a resume. Before we go on, are there any other key things that a medical microbiologist should be thinking about when using Penicillin G in the clinic?
Well, you should always think about how long the treatment should last and consider alternative drugs if you think there might be resistance.
Oh, yeah.
The source material does offer some guidance on those things. For example, on page 38, it outlines the specific recommendations for prophylaxis in rheumatic fever, and it really stresses how important it is to adjust the approach to each patient's situation.
Okay.
Yeah, it's about, being a bit of a microbial detective, I guess, constantly adapting your strategy as new information comes up.
For sure. For sure. Speaking of adapting, I'm kind of curious about something I came across in Kucers. There seems to be some back and forth about Penicillin G's effectiveness in certain Lyme disease cases, specifically late-stage Lyme with those neurological symptoms.
Yeah.
Have you seen this at all in your work?
Yeah. Using Penicillin G in late-stage Lyme disease it's definitely complicated.
Yeah.
And a little controversial, too, I guess you could say.
Okay.
It's been a mainstay for treating early Lyme, but the evidence for how well it works in that late neurological Lyme it's not as clear.
So what's causing all the controversy then?
Well, some studies suggest that oral antibiotics might work just as well as intravenous Penicillin G for early Lyme. But for late neurological Lyme, it's still up for debate, what's the best treatment. Some clinicians are big on that intravenous Penicillin G because they think it can get into the central nervous system better. But others argue that longer courses of oral antibiotics might be enough.
I see, yeah. And Kucers does mention that treating late-stage Lyme is tricky.
Right.
Especially because of those, persistent symptoms.
Yeah, for sure. And we got to balance the potential benefits of that intravenous Penicillin G with the risks, right? Remember those hypersensitivity reactions we were talking about?
Right.
Those are a real concern, especially when you're talking about longer-term intravenous therapy.
Yeah, and not to mention the practical challenges of having long-term intravenous access for patients.
Exactly. It's not always, feasible. It's not always something they can tolerate well either.
Yeah.
So it's a tough decision, really.
Right.
You have to weigh the evidence, but also think about each patient's individual needs and preferences.
So it sounds like we just need more research to figure out, the best way to handle late-stage Lyme. And in the meantime, I guess we have to just use our best judgment and our experience.
Absolutely. And this leads us to another really important part of using Penicillin G, antibiotic stewardship. It's a term that we hear all the time.
Yeah.
But what does it actually mean, in this context?
That's a good question, yeah. It's easy to just throw those buzzwords around.
Yeah.
But what does practicing stewardship with a drug like Penicillin G actually look like?
Well, stewardship starts with making sure we're using Penicillin G the right way, which means, a good diagnosis, making sure it really is a bacterial infection that Penicillin G can actually treat.
Right.
We don't want to be using it when we don't have to, or for things where it's not likely to be effective.
So it's about being, selective, strategic.
Exactly. And it also means using the right dose and giving it for the right amount of time. We want to kill those bacteria, but we don't want to be contributing to resistance.
Right. So that's where, the expertise of a medical microbiologist is so important.
Yeah.
You guys are the ones guiding the clinicians on proper use.
Exactly. We're like the guardians of that antibiotic susceptibility data. We keep track of the resistance patterns, we advise on the testing, and we help clinicians pick the best antibiotics for their patients.
Yeah.
It's a team effort, really.
Right.
We're all working together to make sure that Penicillin G stays a useful tool for as long as possible.
Yeah. So it's like a balancing act.
Yeah.
Using this powerful drug well, but also protecting it for the future.
Exactly. And speaking of the future, I'm interested in what you think might be next for Penicillin G. Are there any advancements or research areas that you're particularly excited about?
Well, personally, I think the potential of these new drug delivery systems is really cool. Imagine being able to get Penicillin G just to the spot where the infection is,
Right.
Reduce the exposure to the rest of the body.
Yeah.
And cut down on those side effects.
That's a very promising area, yeah.
Yeah.
And then there's that whole field of personalized medicine. Could we one day tailor Penicillin G therapy based on someone's genes or the specific bacteria causing the infection?
Yeah, the possibilities are pretty amazing. It seems like we're at the start of a whole new era in how we treat infections.
For sure. And we can't forget about the ongoing search for new ways to target bacteria. We talked about PVPs, but are there other weaknesses in bacterial cells that we can, exploit the search for new antibiotics? It never really stops.
Yeah, it's a constant race, right? Against these evolving threats. Which brings us to, I think, a really important question for our listener. Given how things are changing, what role do you see Penicillin G playing in the future of infectious disease management?
That's a good question, and one that's, we're thinking about. We've talked about its history and how we use it today, but I guess its ultimate legacy is still being written.
And who knows, maybe one day we'll even figure out how to stop resistance altogether.
Now that would be truly revolutionary.
Yeah.
But until then, we have to be good stewards of the antibiotics we have, including that old friend Penicillin G. We've covered a lot today.
Yeah.
From its structure and how it works to the subtleties of using it in the clinic and that debate about its role in treating late-stage Lyme disease.
Yeah, we even touched on antibiotic stewardship and the exciting potential of future research. Yeah, it's really been like a trip back to the basics.
Sometimes I think, we get so focused on the newest things that we forget about the stuff that got us here, the giants we're standing on.
It's true, yeah. We often, I think, overlook the history behind these really important antibiotics like Penicillin G. But going back to Kucers really reminded me of, just how much we've learned.
Yeah.
How far we've come.
And how much more there is to learn.
Yeah.
This whole deep dive has really made me think about, the importance of staying curious, even about the quote-unquote old school stuff, right?
Yeah.
Absolutely. I think that's a really good point, especially for medical microbiologists. We're the ones on the front lines of this battle against infectious diseases, and really understanding these fundamental antibiotics. It's essential.
Couldn't agree more. Well, I think we've really unpacked Penicillin G pretty thoroughly.
Yeah. From,
where it came from and what it works against, to those really important things to consider about dosing and toxicity and how it's used in the clinic. We even talked about some of the controversies, right?
We did, and we can't forget those little glimpses into the future of antimicrobial research.
Exactly, from those new drug delivery systems to personalized medicine. It's pretty exciting stuff.
It is, but I think as we look ahead, it's really important to remember what we've learned from the past. Antibiotic stewardship, using them carefully, keeping an eye on how things are changing. All of that is so important for making sure these life-saving drugs keep working.
It's like we've come full circle, right?
Yeah.
We started with history, and now we're looking ahead, but we're doing it with knowledge and a new appreciation for how powerful these antibiotics are.
I like that. I think we've given our listener a really solid foundation to understand the complexities of Penicillin G.
Yeah.
And its place in this ever-changing world of medical microbiology.
And on that note, I think we'll wrap up this deep dive. Thanks for joining us on this exploration of Penicillin G. We hope you've learned some valuable things that will help you in your work and maybe even spark your curiosity a bit. We'll be back soon with another fascinating topic to explore. Until then, stay curious and keep those microbes in check.